Since March 12, 2022, when Ghana recorded its first two COVID-19 cases, our story with the virus or the viruses has evolved. So far, we have seen about 164,000 confirmed cases. Globally, the number of confirmed cases has been over 500 million. When you talk of deaths, we've seen about 1,400 people losing their lives, unfortunately. Globally, deaths have been over 5 million or 6 million thereabout. Now, we are currently at one of the centers that was used in housing critical patients. We're currently at the regional hospital in Accra, the Ridge Hospital. Now, this facility was used to receive and house patients that were in critical condition. Other centers include the Ghana East Hospital, for example. Now, back then, when we had our first 4 waves, you would, if you went beyond this door, you would have seen persons with oxygen masks and the likes. Persons have been losing their lives. Now, through all of this, education campaigns have been embarked on by government. The need for us to wear our nose masks, the need for us to wash our hands, using the Veronica bucket, the need for us to keep our distance, social distancing. Now, it appears that as the numbers have dwindled, care about COVID-19 has also more or less gone down a bit. But then the story is changing. The numbers are going up. We have over 200 new active cases as we speak. 200 new cases. The active cases are about 1,311 as we speak. And it is concerning for authorities or key stakeholders who are trying to ensure that we do not have a 5th wave of COVID-19. Now, currently here at the Ridge Hospital, and for CNR today, we will be looking at the evolving story of COVID-19. Why are the numbers rising? What should be done? Are we having more cases at the ICUs and the treatment centers? What would be the direction that we need to take? Do we need to start wearing our nose mask again? Should restrictions be put on gatherings? What should be done? So we're here. We'll be engaging all the stakeholders and also traveling around the region, the capital region, to get some answers and also see the way forward. I currently have with me one of the management members of the COVID-19 in the country. I see you are wearing your nose mask. I'm also wearing mine, but for the longest of times, it appears, or in the past few months, Ghanaians have discarded it because many thought COVID-19, has gone away. What is the current situation? I mean, should we be worried?
Yes, we should, because the cases are on the rise. Currently, we have about 1,311 active cases, and we have about 243 new cases, which means that within the next 24 hours, cases may be more. New cases may be more than the 243 we are having currently.
The data we have goes back to when exactly? Which date?
It just started about close to 3 weeks to a month ago when the story started changing. The first reason will be that because generally we are in the rainy season, we are in the cold season, which is a season for flus generally. And Omicron has shown to be, to show just flu-like symptoms. So possibly many of the flu symptoms that people had, they might have taken it for granted because Omicron is just like any other flu. And in fact, there are other coronaviruses that are just flu viruses. And so, yes, we should begin to reconsider putting on the mask. I have been of the view that many misconstrued the president when he said the mask was no longer mandatory. And I think the media should have engaged public health people more to explain what it meant. Because gatherings generally, this is a pandemic, and gatherings generally were not free from wearing the masks. For instance, like hospitals where, like mine, the Greater Accra Regional Hospital, where most of the referrals come, you cannot stop wearing the masks. And we realized that soon after that, the Ghana Health Service issued a communique that places, hospitals, and especially health staff should not desist from wearing the mask. So I have never put down my mask since the announcement was made. And the other places that should have taken a cue from the Ghana Health Service were the Ghana Education Service and maybe the churches and mosques, especially where massive gatherings are, should have taken a cue from the Ghana Health Service. But that notwithstanding, we are where we are because I think we have relaxed the COVID-19 infection prevention protocols. So I think we should take a cue from that and continue wearing the masks, go back to the hand sanitizing and hand washing protocols, especially in gatherings.
Now, currently, news was flying around that the ICUs were full and the likes. Can you confirm for me if that is the case?
For us, we have admitted about 2 cases, but we have discharged them. We didn't have to come back to the main ICU. Many of these cases that we are seeing are being managed at home. So exactly. So for us, there is a COVID OPD. Where once we get the information, we see them on OPD basis, and then we assess them. If they qualify to be taken care of or to isolate at home, we do that. And the protocol for discharge has also changed a bit. So now we know better and we manage them at home.
Talk to me about the vaccination drive, and also, are we seeing more men, more women getting the COVID cases recently? I mean, the vaccination drive first.
No, so I still think there is some vaccine hesitancy in the public. Single dose, for instance, just about a little over 40% of the total population has had a single dose. Less than 30% have had the double dose, and the boosters less than that still. So I think that we are far from hitting the herd immunity, and people should take it seriously to get vaccinated.
Dr. Adepa, I'm very, very grateful. Thank you so very much. Now, my colleague Kojo Ajman is at the Ghana East Hospital, which received a lot of people during the 4 waves. Now he is there because currently there are some patients on the ground, and he will bring us up to speed as to what the situation is at that place. Kojo Ajman, take it away.